Hello and welcome back to another episode of Taking Control of Cancer. I'm Steve Bland, and this podcast is, as always, brought to you by the North East London Cancer Alliance. And this is another one of our news episodes. We're looking at all the cancer news in July 2026, and I'm doing that, as always, in the company of Femi Odewale, the Managing Director of the Alliance. Hi, Femi.
Hi, Steve. How are you?
Yeah, I'm good, thank you. Enjoying the warm weather. We're recording this on Friday the 17th of July. We have a new, I don't know if it's been completely confirmed yet, but there's definitely a new leader of the Labour Party. He's a northerner. We can talk in future episodes how maybe that's going to impact the National Cancer Plan and that sort of thing. But it's enjoying the sunny weather. On that topic, if you hear a slight panting in the background, it isn't me. I'm not making odd noises to you. It's my dog. He's sat behind me and he's finding the hot weather a little bit much to cope with. Are you a fan of the heat?
I love the heat. And right now I've got all the doors open. I've got air flowing through, but it is lovely though. I prefer this to the cold weather. So I think we've got to be cautious not to complain.
Absolutely, we do. But as a nation, we're not good. If it rains a bit too much, we can't cope. If it's a bit too windy, we can't cope. If it's a bit too cold, we're not so good. If it's a bit too hot, it's a bit too hot. We like it just in the middle, don't we? Like a bit of drizzle, 18 degrees.
I think this is just in the middle, though. I think it hasn't rained too much, and I think it's been nice. I think it's lovely.
Well, I was saying to you, wasn't I, before we started recording, that I'm at an age now where it's beautiful and sunny, but I'm looking at the garden thinking it needs a bit of water on it now. It's a little bit crispy and yellow, so could do with a little bit of rain, which we're not normally short of up here. But anyway, let's get into the all the news from July, because it has been a busy month. There's plenty to talk about. The first one I want to talk about is actually some really good news. For the first time in a 5-year period, no cervical cancer deaths were recorded in women aged 20 to 24. That's the period 2020 to 2024. The headline on the BBC: children vaccinated at age 12 to 13 against HPV have close to zero risk of dying from cervical cancer before the age of 30. Landmark new research reveals. And we've talked about this HPV vaccine quite a few times, haven't we? And how amazing it is that we've actually got people joke about finding a cure for cancer. Here we are with a vaccine that people can get, and the evidence is that it really works.
Evidence is strong. It's work, and it goes back to what I'm probably going to say, having a preview of some of the stories already throughout this whole podcast today, which is what a great time to be alive. So it's exciting. I mean, for the first time, 16 to 25-year-olds are simply, we're eliminating this particular type of cancer. So it's great news. It's great news. Dr. Alex Lawrence, who's our expert reference group lead, and she's also a consultant gynecological oncology consultant.
Easy for you to say.
Such a mouthful. And she's been doing a lot of great work in this space as well, really, really promoting this and promoting the work. I mean, she did a number of work with Charisse Weeks, who is one of our project managers, and they've been visiting universities, they've been doing freshers fairs and so on this space, just really promoting this, and a number of other kind of promotions to support this. So yeah, really glad to see that this is the impact that it's having.
It's fantastic. And as you said, a couple of pieces of North East London Cancer Alliance work, just to reference. The first is the piece with Charisse Weeks in Freshers' Fair. The second aimed at gay, bisexual and other men who have sex with men up to the age of 45 who are at high risk of HPV. The Alliance has worked with the charity The Love Tank to develop a webpage and a booklet with information about HPV and the vaccine. And we're running a series of under-the-radar events where men can be vaccinated discreetly without needing to attend a sexual health clinic. It's all fantastic work, and it's just I haven't got the numbers in front of me, but we've talked about HPV a few times, and one of the big frustrations is that it's it's available, and yet not everyone is taking the chance to get vaccinated, get their children vaccinated. I think it's just really hammering the message home that as this piece of research says, it really, really, really works, and it's I've got a young daughter. She's only 3, so she's a bit away from this, but I would have no no hesitation in getting the vaccine for her because it's fantastic.
I mean, to think that in her era, there's going to be little to no to none of this cancer.
Yeah,
That that's phenomenal.
it's fantastic, isn't it?
Mm.
We're going to talk about something else that we've talked about a fair few times on this podcast, and that is the National Cancer Patient Experience Survey. A bit of a mouthful. We spoke about it. A couple of podcasts we've done on this. Really important piece of work, just to give patients a bit of a chance to give feedback on their care, different aspects of the care. But the results are in, and around 64,000 people responded to the 2025 edition of the survey, giving an average score of 8.92 out of 10. And look, I mean, a record 700,000 treatments were carried out in this year we're talking about. So, the caveat is it is quite a small sample size, but nearly 9 out of 10 in terms of a rating for cancer care, sounds like a pretty good number to me.
It is, and I think it's still important for us to definitely kind of encourage that patients complete these surveys. I think there's a lot of work. I mean, what this highlights is that one, even from the sample that the sample that's been able to capture, there's great work happening in this space, and there's much more satisfaction. But also at the same time, there's a lot more work that the NHS in general have to do around encouraging patients to really fill out these questionnaires. They're really important. It allows us to improve our services. Crucial.
Particularly when we're talking about an area like Northeast London where there's so much difference in so many ways, cultural differences, socioeconomic differences, geographical differences, so much going on that less than 10% probably give the full picture. There's going to
Yeah,
be there's going to be people who are in certain communities who probably 0% of them have filled it in, and you're not getting that data. So that's so much great work is going on with the Alliance, I know, to get out into those communities and really find out what makes a difference to them, what matters to them, and how
absolutely.
we can work on the way that cancer care is delivered, to make sure they get the best service possible. Um, let's have a little chat now. Now the next two, Femi, we're gonna get a bit technical here. Um, so this is a story about a service that was pioneered at Addenbrooke's Hospital in Cambridge, that could help up to 3 times more cancer patients benefit from whole genome sequencing, and it's won a national award and been accredited for use across the UK. We did a podcast last year. I went up to Leeds for an event, and we chatted to a few people around the use of Signatera, and it's all about DNA testing that can inform treatment decisions for cancer patients, inform whether people might need treatment in the future as well. And this is the way it's going, isn't it, Femi? It's fantastic to see a lot of this innovation. There's so much that we can learn, isn't there, across the UK, globally as well, taking that information and using it to build on the service in Northeast London.
Yeah, absolutely. And like I said earlier, what a great time to be alive, knowing that you just got another 10 years and a whole load of these breakthroughs in treatment and prevention are going to be here for good. It's going to be a standard everyday way of providing medical care. So I think this is obviously I welcome this. This is amazing. And this particular space is one that we've just got to really watch out for. I think they're going to do phenomenal things in cancer prevention and treatment. So yeah, really exciting. Let's see what else is to come in this space. Really, definitely welcome it. I mean, we will continue to push the topic of genomics in a lot of the podcasts and a lot of the conversations.
Absolutely, it's so interesting, isn't it? And
Really interesting.
yeah, as I said about my little girl, I've got twins who are 3, and when you said it before, it just kind of makes you think, doesn't it? By the time they're 18, I mean, can you just imagine like where we're going to be on some of this stuff?
Mm,
You know, the the rate at which we're developing tests and treatments and vaccines and things like that, it's extraordinary. Actually, a big part of that is, look at the next story to talk about is is AI. There's a story in radiology who they published a Swedish study. 3 commercially available radiology artificial intelligence systems have shown the potential to flag early signs of breast cancer up to 6 years before a diagnosis. That's absolutely amazing. We know AI is used a lot, obviously, in lung cancer. Um, we have spoken, I think, on this news podcast about breast cancer and some studies in different parts of the world. But it's amazing, and you guys, we launched the AI strategy, didn't we, a few weeks back?
mm.
Big event in London, and it's fantastic. I'll give you guys all the credit in the world because chatting to some of the guys that you're working with, it's not every alliance, it's not every trust, it's not every part of the country that is so determined to make sure that AI can have the biggest impact. And I think you guys are doing that.
Yeah, no, absolutely. And it's like you said, we've got a whole AI strategy around this. And again, technologies like this is the type of technologies that we hope to partner with some of these companies that are developing these and carry out some pilots in future. And I've always said it on here, that AI space is a crucial one, and it's going to do wonders in the space of kind of healthcare. I mean, it's not it's not the savior, but again, the fact that you can identify kind of commonalities in certain, or you can see, you can see things in our data that can identify diseases far earlier or show patients who are likely to have specific types of diseases far earlier is amazing. So that combined with genomics, combined with all of the things that's happening in this space right now, is really going to help change the direction of travel for cancer treatment for the future. But I mean, look at that again, another kind of taking action a lot quicker
Yeah,
than we would normally be able to using machine learning.
it's extraordinary. I'm just reading the study now. 20% of breast cancer cases in the study demonstrated mammographic signs that are already visible to AI around 6 years before diagnosis.
That's amazing.
And we know, don't we, that not just breast cancer, but every single cancer, if we catch it early, the chances of treating it, curing it, are so much higher. I've said a million times on this podcast, my first wife died from breast cancer. We didn't catch it early enough, um, and it's amazing, absolutely amazing to think that as I said, when we get 10, 15 years down the line, my children are going to be a bit older, and we're going to be be having things like this, which will be commonplace. I'm sure they'll be commonplace. So many different ways of catching cancers early.
Definitely. And a key thing, and I've said it quite a few times. I mean, this is a tool. As a prime example, this is a tool, and this tool doesn't necessarily replace, the great work that the consultants are currently doing. It's there
Yeah.
to assist the consultants to be able to. It's there as a support system to the consultants in this particular space. And again, it's exciting to see more of these types of assisted tools that will support clinicians in making decisions and having much more targeted treatments made available to patients. So, really exciting time.
Now the last one, Femi. Football's a bit of a touchy subject this week, isn't it? But former England footballer Paul Merson, a bit of a legend, if you're an Arsenal fan particularly. has revealed that he was diagnosed with skin cancer in 2012. After delaying getting a checkup for months, he said that he found a mole on his back. One of his children actually found the mole on his back that was bleeding. He didn't know that if it was um, didn't know kind of what it might be, if it was a man thing, if he was just afraid to go to the hospital. This obviously a little while ago, when perhaps people were a bit less willing than they are now to go and get these things kind of checked out. But it's another one. We should say it's really warm outside at the moment. I think the
Mhm.
weather's going to continue for a little while yet. We're slapping on the sun cream on not just ourselves but the kids as well. They're in and out of the paddling pool in the back garden. Everyone's on holiday. The schools are breaking up. We're going to beaches. We're hanging out in the park. It's absolutely imperative to keep hammering that message of to be skin safe. It doesn't mean being inside all the time. It just means look at the sun cream. Look at it. Is it SPF 30 as a bare minimum? Are you reapplying every time you come out of the water?
Mm.
Are you limiting a bit of exposure to sunlight? Are you wearing hats? Are you putting hats on your kids? There's so much that we can do. We've actually done a couple of podcasts on it. We did one a few weeks back with loads of good advice. So do take a listen. But it's a big one this time of year, Femi, isn't it?
It is, and we are in that period. I mean, you opened this podcast today with the weather. It
Yeah,
is warm. It is hot. It's been relatively hot for weeks now. So now is the season where people do really need to follow exactly what you just said just now, really, which is wearing sunscreen, getting some shade, covering themselves up in the right places, but also check the UV index. I mean, this isn't. I'm not sure this is something that I don't check the UV index. But again, it's just take all precautions during this period as well. And it's an interesting. Paul Merson's story is quite an interesting one. Again, we love it when people share their
yeah,
experiences, so that
absolutely,
it makes people aware of well, it makes people much more aware.
definitely. I think it's easy for him, probably 14 years ago to let that one go, but he's brought it up on a interview on Good Morning Britain.
Mm,
Um, we did a podcast the other week about actually on World Prostate Cancer Day with Dr. Toby Lambeth, at his GP surgery, and we talked a bit about why men are a bit more reluctant to come forward, and there's a load of different reasons, but I think when there really isn't any excuse when it comes to skin cancer. I think I can understand, or I can excuse um, a little bit of reticence when it's sort of sexual health, or
mm,
down there stuff. If it's
mm.
your prostate and all sorts of things around there. um I said down there stuff with inverted commas. I don't really say that, but you can excuse that a little bit or understand it. But when it's skin cancer, I think we just need to be a bit more aware and a bit more willing to go and have things checked out.
Yeah, absolutely.
It's not going anywhere soon. I think it's only going to get hotter, isn't it? The UV indexes are going to get higher and higher. Um, Even up here in the north, we've been having some quotes for air conditioning in the house. It's only going to get hotter.
It is.
This
It's
is
best for people to start future proofing now, isn't it? Because
well,
this,
exactly. Like we figured, it's only going to get more expensive,
yeah,
and it's only going to get warmer. So let's have a little look at it now. And like one chap who came around said he'd had 65 calls in one day. He's like, there's busy, and then there's wanting to quit busy. Like this, this
yeah,
is too much. But yeah, but I think it is so important to keep on banging that drum. Not just with skin cancer, although that is really important this time of year, particularly, but with any cancer, anything that you're worried about, go and get it checked out by your GP. That's the message, isn't it?
that is indeed said it well. Well said.
There we go, Femi. That's July done. Are you heading off on holiday anywhere? Are you, off to Paris, I think, this weekend? Are you?
Up to Paris this weekend, and that's
Beautiful.
about it for now. For now, we'll figure out the rest. We'll wing the rest, should we
Well,
say?
we'll catch up on your romantic, no doubt, trip to Paris when you come back. I have you down as an old romantic, Femi. I think
Oh, yeah. I'll try and fit that image. I'm sure the other half will quite say that's the case.
we'll find out all about your trip to Paris in August's news edition. But until then, have a wonderful summer.
You too. Catch you later.